Reachout Centre Trust is a non-profit organization founded in the year 2003. Its main mandate is to provide harm reduction, preventive and treatment services to those affected by or vulnerable to alcohol, drug abuse, HIV and AIDS in the coast region of Kenya. The main driving factor for its establishment was the growing empirical evidence of increased use and abuse of alcohol and drugs in the region.
From our own experience, it's easy to buy heroin from the street of Mombasa than to buy sugar from a supermarket.
The organization is committed to serving people who use drugs and the community through outreaches, outpatient drug detoxification, ongoing drug addiction and counseling, testing of HIV and advocates for the rights of people who use drugs, among other services. The success rate is commendable. Over 13,000 people have been reached with the harm reduction services. Currently, 5,374 are receiving an assortment of HIV prevention and linkage services through the harm reduction program. Through the needle and syringe program, we have prevented HIV transmission among 2,435 people who inject drugs within Mombasa and Kwale counties. About 500 clients have benefited from the medical assisted therapy MAT, which has helped clients stop taking heroin. Over 10,000 people who use drugs have benefited from the advocacy program through intervention that support public health approach to the drug use program, such as access to fair trial, psychosocial support, and access to alternative sentences for pet drug offenders. (902) clients have benefited from inpatient drug treatment program, most of who are now living a stable, ethical, productive and a drug-free life.
Reachout mtaani, na katika kitaa hii leo nimeweza kukita kambi maeneo ya Kibokoni, ambapo hapa nategea kuona ni yupi ataweza kujipitisha ili tuweze kuongea. So kaa standby kusikia kutoka kwa Reachout mtaani. Harm reduction saves life, au sio? Tunagusia yale mambo ambayo yanaendelea.
Very well. Hello and welcome, and thank you for joining us for today's webinar. My name is Solomon Zuli for Galatix Media. Galatix Media is a digital media company that is based in Mombasa, dedicated to providing inspirational and transformational stories which enlighten the society on issues related to their everyday living and giving hope to the community by telling the community's story. Today, we are presenting stories of Ramadan from people who have been actively contributing to the community and cushioning it from the adverse effects of the coronavirus. We look to their stories, initiatives, and their passion in giving back to the community before and during this holy month of Ramadan. Please, you feel free, you can comment, you can like, you can share, and subscribe to our social media platforms. That is at Galatix Media on Facebook, Instagram, and YouTube. And on Twitter, you can also reach us at Galatix Media, at Reachout Centre Trust, and also you can follow me on my social media platforms at Solomon Zuli. If you have any questions during this presentation, please type them into the comment section that is on your Facebook or on the YouTube. I'll bring them up to during this presentation, and we'll also have time for questions and answers during this live presentation. You can support Galatix Media. By the way, we are doing a crowdfunding campaign towards building of a production studio that is in Mombasa County through the pay bill number that will be running on your screens later on. That is 961 700 961 700. The account number is 32037. Right on your screen, hapo chini, you can just see that, and you can support us. Now, without further much ado, let us introduce our guest and begin this discussion. Our guest today is a good friend of mine. He is doing an amazing job in the community. Very, very, very congratulations for that, Mr. TAIB Abdulrahman Basheeib, who is the director of Reachout Centre Trust. Now, just a brief introduction about Reachout Centre Trust, which is a leading non-profit provider of substance abuse treatment and prevention services located at the Coast Province of Kenya, established in 2003. I hope I'm right on that. The organization is committed to serving vulnerable populations, including drug-using populations, including commercial sex workers, MSMs, trafficked persons, and those at risk of spreading the HIV and AIDS virus. Today, we have Mr. TAIB Abdulrahman as a representative of the group. Congratulations, TAIB, for the amazing job that you're doing for the community. Welcome. But before we go further, your CV is quite heavy, TAIB. I hope I captured everything. If I didn't, kindly feel free.
Thank you very much.
Give us a brief introduction for those who are joining us for the very first time. Just to know who TAIB is. Yes.
Yeah, thank you very much. I'm TAIB Abdulrahman. I come from Mombasa, born and bred here, and I studied here also. And I ventured into this work where I was in Mombasa Polytechnic by seeing the community which has been affected, that is our community, on the issues of drug and substance abuse, to be able to see how best we can be able to turn around the issues of drug and substance abuse, especially for our community and youths who are suffering from the pandemic of drug abuse and also the issues of HIV.
We have seen Reachout Centre Trust from most of us, but a lot of people don't know the history behind Reachout Centre Trust. What is the history behind it? Yes.
Yeah, the history behind it is very interesting. It started with one person who we respect more, and we pray for him also during this month of Ramadan, and also pray for him for what he has managed to do. Murad Saad was the founder member of Reachout Centre. He started this organization in 2003 and managed to put in structures and procedures that can be able to support the community in turning around the issues of the drug abuse within the community. And this has really helped us a lot. It has helped me a lot, because while I was in in my studies, I met this very good gentleman who was very motivational in terms of giving and supporting youths. Murad Saad was one of the founder member of this organization, and he managed to mentor us since we were learning, since we were in school, to be able to start programs within awareness in schools, to talk within our community and try to help many people within our society that are affected by drug abuse. 2007, he managed to put in place measures, and November he passed away. And after his death, we managed to come up with the team and tried to go on and leave the legacy that he has left behind. So from 2007 up to now, we've managed to expand different places. We have institutions at different counties. We have a drop-in center in Taita Taveta in Voi. We have an institution in Kwale, in Kombani. We have a drop-in center in Kombani, which supports the people who are coming from that area, so that they should not travel very far to look for treatment and care and support, and also prevention program while they are within their counties. And we also do awareness within different other counties that we don't have structures or physical structures in Tana River, in Kilifi, and also in Lamu. So we have been able to capture the whole coastal region, and also at the national level, we have also interacted with different counties in Kisumu, in Nakuru, in Nairobi, and also trying to see how best we can also mentor others who are also starting up different organizations in the country, to be able to support them, not to reinvent the wheel, but to go on to where we have started, and being able to have ripple effect within the giving of service within this area.
Wow. So, you know, most of us, when we do things, and I've seen you work, these are things that you are passionate about. Is there a specific or personal story for you that you do this work so passionately? Do you have any family member, or have you personally been involved in the usage of drugs or something like that, for you to be so passionate about, you know, helping the community?
You know, what has really motivated me are very more. There are different factors which have really given, and which is giving me every day. First is the community that we are serving, because I'm coming from this community, and I've seen people having encountered into the issues of drug and substance abuse at very early ages in life, and they've managed to try help themselves up. They couldn't manage. Some of them died on the process. That has really kept me wondering how best can we be able to support the community. Second is the founder member of this organization. He was very passionate, more than me, I can say, and he was doing it from his own pocket, from his own initiative, from his own engagement with the community. And this has really helped me to think that if people can be able to serve the community without any boundaries, without any interest, why can't I do this? And this is something that is really giving me more support and insight. Of course, we have mentioned it early. At my early ages in life, I've also encountered into drug and substance, and we've managed to, as peers, as youths, encountered in different levels in terms of drugs, and really took me into a very bad shape. And I realized that I need to take shape and being able to come back to normalcy and being able to support others, and also to see very close friends and relatives who have been into drug and substance abuse have really also motivated me to try and see how best can I be able to link them up with services, to link up with professional counselors, because myself, I couldn't help them. I couldn't support them, because we have a relationship, that a bond that has really connected us together. So that has really also linked me to how best can we be able to bring in together professional counselors, people who are on the community, to be able to support and being able to give treatment to those who are affected, and also having a better lives in the end of the day.
So, Taib, how has it been for you and the entire team since you started this organization? How has the journey been to date?
Okay. The journey has been with ups and downs. We've managed to have challenges within the journey that we are going through. But when we started in 2003 to 2007, I can say we had someone to lean on. We have our mentor. We have someone who will support us. We will have limited resources. He will try and look how best we can be able to get resources from within himself, and also from others and well-wishers. But now, after 2007, it it was, I say, a big blow for us because we didn't know where to start, where to end, and how can we be able to see the vision or to envision us going through keeping the legacy along. And of course, it was very tight. 2007 to 2010, it was trying moment because it was new field, it was new decisions, it was you now to do all the decision, and everyone was looking up to you. Will you be able to fit into the shoe? Will you be able to be able to support the process well? Will you be able to work with the community well? Will you be able to interact with well wishers and donors well? So it was a high expectation, and being able to mingle, and the time that I've been with my mentor, I think I learned a lot on how to do all this thing and be able to turn around the support that was there, and being able to have that faith within the community, and also seeing that belief on people that you can be able to work on this, you can be able to move on, and being able to put the learnings that you've been able to learn within the time that you have been with your mentor. It's really encouraging to be able to work together with a team of dedicated community members, friends who are working with us, colleagues who are working with us, and also partners who are working with us have been very supportive. And I really want to appreciate all our staff who are there. We stood by together, and up to now, we have people who have worked with them 10 years, 5 years, 6 years, 7 years, 8 and 9 years, 12 years together. And that's keeping us together to be able to see the outcome that you've alluded earlier, that is functioning well, is working together, and also as a teamwork, we've managed to do a lot together. Yes, Solomon.
TAIB. Is there a specific target of people that you handle as an organization, TAIB?
Yeah, we work with the community. That's our priority area. Specific to those who are using drugs and substance abuse, those who are affected by HIV, TB, hepatitis, to try and see how best we can be able to give prevention measures and also demand reduction measures, and also the issues of harm reduction measures, which is helping them towards understanding how best they can be able to seek into treatment, how best they can be able to go on with the treatment, and how they can be able to stay safe within the using period until they get support, and also prevention programs, which are very supportive in terms of young people, the youths who are engaging into casual using, experimental. We try and help them not to proceed to the next level of injecting or using heroin, but we hold them at that stage to be able to engage them into creative engagement, and also supporting them towards linkages to areas like maybe professional, maybe soccer, maybe sports of different types that they will want to do, so that they can be able to encourage. Especially within the pandemic, we had a lot of cases of young people who have come into drug use, and we say these are not cases to take them into rehabilitation. These are cases to form them into groups, to support them into groups, and to help them into understanding why they should be able to why should they be able to stay clean, and how will they be able to maintain the process. And some of them are coming into issues of drug because of peer pressure, availability, the cost within the community that they are living into, and then that curiosity of how do you feel when you use this particular drug. So we try to help them understand the areas that are supportive, and also what are the links, and also engage the family members, because we have seen most of the time that family members will want to give up. And that is where now we are opening room for these young people to be able to go into in-depth of drug use. So those are the priority areas that we work with.
Okay, just before we go for a break time, questions that people have been asking, that what kind of programs do you offer as Reachout Centre Trust?
Okay, One of the first program that is a primary focus is drug rehabilitation. This is a 4-month program where we engage people into an inpatient program. We help them go through a behavioral counseling process, eclectic approach in terms of counseling, that is cognitive, behavioral, helping them in terms of identification of their problem, the cycle of change, to be able to understand where they're coming from. And this is building the holistic approach in terms of how best they can be able to choose to live without drugs and being able to work within the possible support system. The second program is the harm reduction program. This is a wide program that is covering most of the counties to be able to give information, knowledge for those who are affected by drug use, HIV infected, affected by drug use. How best can they be able to come out? How best can they be able to prevent the HIV? How best can they be able to reduce the amount of drug that they are using, and eventually to have abstinence process? So that is the harm reduction program. Then we have the engagement of advocacy program. This is where we engage people within access to legal services, within fair trials, that some of them are caught within difficult situations. Maybe they are caught within the vicinity of using. How best can we be able to advance their processes in terms of not going to jail?
Hukuomba Mola Rabba uliyepweke jalia, tuwaoneshe mahaba wote walioathiriwa, hawa wana wenye haiba Mola tawasaidia. Wala sina uwerevu dua nikiwaombea, na sina ushupavu nyote yayaelea, ndiye mimi iko love tumanana maridhia, saidia usiwadhibu.
Kutokana na media ndio tumejua kuwa kweli tunafanya makosa, tunawanyima haki zao watumiaji madawa. Ndiposa tukakubali kupokea mafunzo na tukaamua kubadilika. Na sisi sasa tumebadilika, tunajua vile tunaishi nao, tunajua vile tutawahandle. Tukiona mahali hatuwezi, tunapiga ofisi simu na huwa tunakaribishwa wakati wowote. Support, don't punish. Saidia, usiadhibu.
We as officers from County Court, Mombasa, we came to know and realize that these offenders who've been brought to our court, most of them are sick people, especially the ones who used to be charged under the drug offenses, illegal dumping, committing nuisance. They are sick people who needs to be supported, not to be punished. So we say support, don't punish. Saidia, usiadhibu.
We have come to realize that these people need to be treated, they need to be assisted, and quite a number of them have gone through the therapy and are now very useful characters in the field. We have some whom we have also as a department empowered to do driving, who are normal thoughts. And today we have very proud persons. I wish to appreciate the media for the role that they have played, and that together we have been involved in quite a number of engagements with them, with Reachout, in regard of sensitizing the public, in regard of having seminars or key players in the justice system who have been sensitized on the need not to incarcerate or punish persons who are only abusers of drugs, who need help instead of incarceration. Support, don't punish.
Wakati huu ni watu watumizi wa mihadarati, ni watu ambao tunahitaji kuwasaidia na tusiweze kuwadhulumu wala tusiweze kuadhibu, Hili ndio jambo letu muhimu wakati huu, na kuweza kuingiliana sote viongozi na mashirika yote kuweza kuona kwamba at least tumepiga hatua kuweza kuangamiza mambo ya mihadarati katika jimbo letu la kaunti ya Mombasa. Support, don't punish. Saidia, usiadhibu.
Vijana wanaotumia madawa ya kulevya ni wagonjwa kama wagonjwa wa aina yoyote. Sisi kama jamii, kama polisi, kama madaktari, tujaribu kuwasaidia wa vijana. Saidia, usiadhibu.
There is a second option, not incarceration, not killing, not mob justice, but reaching out to them and giving them a second chance. Support, don't punish.
Support, don't punish. Saidia, usiadhibu.
Indeed, support, don't punish. TAIB, this is a campaign that's been pushing for quite a long time. What is it, and what does it entail? Support, don't punish, TAIB, and how far have you gone with it? Has it helped?
Yeah, this is also internationally movement that is going on, but we have customized it to a setting and also putting it in Swahili, Saidia Usiadhibu, so that we can be able to reach out to our community members. We have seen over many years that a lot of people are having misconception of issues of drug. They want people to be incarcerated. They want people to be killed. They're saying these are junkies, these are users, these are people who have messed up within our community. And we don't realize that these are brothers and sisters. These are our people who have come with. I've shared with you, I had a very good friend that we've gone with him 8 years in primary. We went to high school and he dropped out. And we didn't realize that he was doing drugs until he had a mob justice that has been able to be killed by mob justice, and we couldn't help. And we saw that move coming because of the incidents that were happening to his life, and we realized that people need to be supported. People need to be given a second chance. People need to be having people to talk to. You know, people who use drugs have been into the community and there's no one who is talking to them. And even the family members, they don't want to hear about their whereabouts and what they are doing. So we started this process and being able to teach the community that people needs to be they need to be well received, talked to, engage into different discussions. As much as they are using drugs, we cannot move them away or give them that room to be able to be far from where the things are happening, from where services are happening from. So we started with the law enforcers because we realized law enforcers are the one who most of the community members will go report, and this thing will happen to one of them within their lives, maybe incarcerated or taken through the criminal justice system, and some of them will end up into prison, 5 years, 10 years, with just being caught within the vicinity of using. Solomon, I want to repeat this. You're just caught within the area of using. You are not using. Then you go in for 2 years or 1 year or 3 years. So that is where we see the Support Don't Punish campaign coming in very handy, because if we are not helping, we will not be helping if we take this individual and put him for 1 year by sitting within an area that he was not supposed to see. And these places are not gazetted. They are not told that we don't have this or within a country. It's because that is what the norm has been within a community. And someone has been maybe snatched a mobile phone worth 500 or 1,000 shillings, the Kabambe mode of phones. And you find someone losing his life because of a phone. 10,000, 5,000, name it, 10,000, 100,000 phone. But when you lose a life, how can you compare that to money or worth of anything within the lives that you're living into? So that is why we started initiating this. We started with law enforcers. We went to health facilities, to the community, mothers, fathers within our society, and also other departments like prison, so that when we have people who are incarcerated, how do we treat them? And this has been taken very well. We have started the program of methadone within Kisauni. We went to Meritini. We'll be hoping to have a Portrees unit now. We'll have one here in town that is going on. The building is going on. We'll be more than happy to start on it also when it's ready. In Likod, we'll have another program. And for the first time, because of this intervention between the law enforcers, between the community, stakeholders, we have started within Kenya, the first of its kind, giving methadone within the prison settings. I really want to acknowledge the Kenya prison, the health facility, the Mombasa County Government Department of Health, the governor himself, Hassan Ali Joho, the MP of area here, Vita Abdulrahman Sharif Nasir, for pushing this agenda to be able to have now the first of its kind in Africa, Solomon, that in the prison setting, you can get treatment of substance abuse without any fearing of withdrawals, without any fearings of maybe dying. For those who are using alcohol, they will think that they're going to, but they will be given their remedies, that is not methadone, to be able to support themselves within that period of detoxification.
Okay, TAIB, there's been a lot of backlash, especially on what you're telling us just a few minutes ago on matters to do with maeneo or places that people are using drugs, and you have been accused as an organization that probably you are trying to encourage guys to continue taking drugs, especially when you say that, you know, these were some of the statements that were viewed as very controversial type. What do you have to say? And for those who are saying that you guys looks like you're trying to encourage the usage of drugs type.
You know, when we talk about harm reduction, you know, the concept of harm reduction is very new within the country. So when you read between the definition, I'll also share with you, is reaching out to those who are using and impact them with knowledge, with time. Because Solomon, today you like wearing that specs, or you're wearing it because you've been prescribed, or you like to wear sunglasses when you go out, or you like a particular shave. Then I tell you, don't shave this way.
Yes.
Or don't do this, or don't wear this. Like today, I come to the office or to your house and say, stop now, don't do this. That the thing that you love, maybe going into internet, maybe for example, then you tell, don't go into internet for a month, or let's just leave it like that. How will you feel? So that is the concept of harm reduction. You cannot just go to a person and tell him, today don't use. You'll kill him. You'll have that shock. This guy has been using heroin for 10 years. So you have to start slowly weaning into that process. And that is what harm reduction is. If he's using, if injecting, let him get a clean needle and say. And then the controversial movement started in 2010, 2013, when we started the needle and syringe program. Because people, and also the faith-based organization took it in a different way. And we managed to reach out to faith-based organization, the Muslim, the Christian, the Hindus, to be able to teach them. Because little did we know that maybe my brother is using heroin and he's injecting, for example. So if he misses that clean needle every time, he will be able to share with others. And that is where the problem is. The sharing of needle and syringes has been the efficient way, Solomon, of HIV transmission. So if we allow 10 people to inject and share, and out of those 10, we have one who is infected, we'll have little time for them to have the transmission within that number. And towards the National AIDS Control Council, we were saying we want to close the gap of those smaller numbers, of those community numbers that are fewer, but they contribute a bigger number in terms of HIV. Our general population, Solomon, is 6.1 or 5.9 on HIV prevention within Mombasa. So if you look into the HIV prevalence of people who inject drugs is 18%, is 5 times higher than the general population. So if people will have a misconception or a myth into this, and the fact is that we are doing prevention program, we are doing prevention of HIV, and we are not just distributing needle and syringe for any Tom, Dick, and Harry. We have not come to you, Solomon, we give you needles, because we know who are using, who are injecting. We have been able to talk to them. We've been able to engage them for many years, and we know what their needs are. We have also asked them what their needs in terms of injecting, how many times they're injecting. So we have a number which we are working into, and we're trying to see how best out of this number. For last year, this year, for the past 3 years, they have been channeled to treatment center, they've been channeled to methadone program, and that is where now the reduction of those who are injecting, and also the prevalence now is going down because of these measures that we've been intervened. But when you see into the community, and that's where our challenge is, that we want a very quick fix. We want corruption to end today. We want to kill everything and take them to prison today, and we don't have people who use drugs. And we will have people, we have high-end people who are using heroin. We have people in their bungalows, in their apartments that are using heroin, and they don't want any needle and syringe. They are using it in different modes. They're putting into shisha. They're using bang into shisha. They're having high class, and they can buy their own needle and syringe. And that is good because they are doing prevention within themselves. Because when you're high, you can use anything. You can use any person's needle, because when you're withdrawing, you'll want to get the drugs anytime. So we want to put the facts and figures right, that we are working within the community and giving these measures, which has been evidence-based intervention, and it is a government program. It is accepted by the government. It is been having standard operating procedures, and we are not doing it behind anything. We are doing it openly, and we are doing it for those who are in need, to help them, support them. And also another facts and figure is most of our community are shying away because we have brothers and sisters who are using bank, or they're using heroin, and they don't want to associate with them. That's why we're saying maybe when we are reaching out to them, we are engaging, we are encouraging them to use. But no, because we are professional, we have been trained to help them, to intervene with them. Some of them will say, I saw you in a particular den. What were you doing there? That's a very risky area. Why do you go there? They are questioning us, but they cannot go because their brothers and sisters are there. They don't want to support them. We have been calling them. We have been calling relatives, but they have given up. And this is what we want to change within our community, that the fact is that people need to be reached. We need to encourage them. We give them unconditional positive regard. We help them with understanding them. We help them with empathy, so that they can be able to see that they have that option of giving that trial for the second time to be able to be clean.
Okay. TAIB, you have worked with several people, probably at this juncture, just to mention some of the partners that you have worked with, and probably just to appreciate them on all this work that you've been doing towards helping this community.
Yeah, thank you very much. First of all, I want to appreciate the national government through the Ministry of Health, Internal Security, through the at the county level, the regional commissioner been very supportive, Lungati, to be able to support us in terms of interaction without the linkage within the NACADA support that we've been able to get from Meritini. At the county level, county commissioner has been very supportive to be able to have enabling environment within the community, and also linking us to the law enforcers. The governor, Hassan Ali Joe, has been very supportive in terms of ensuring that the Ministry of Health at the county level has been able to engage with us, to be able to develop different policies. And I'm very happy today. We'll have a follow-up meeting tomorrow. We have developed Mombasa business plan for people who use drugs, or for medically assisted therapy program. We want to see how best we can be able to engage the brothers and sisters who have come out into drugs, to have linkage into business, into opportunities for work, into opportunities to start their own businesses. And this has brought in different departments: the Ministry of Sports and Gender, Tourism, Health, Children, the Probation, NACADA, and we were all together to validate this document, which will help in big time. And this was the under leadership of the health department, within the county government under the leadership of Hassan Ali Jo. I also want to appreciate Honourable Abdulrahman Sharif Nasser, who has been very instrumental. I think the issues of community complaining has started when he moved in also to move this motion of needle and syringe. Before getting before being a member of parliament, he was supporting us to advocate for needle and syringe program. And I think this, he has also mentioned it widely, that when he started that, very close friends and the community, they said, if you go within the campaign, you won't be able to get this seat because you're encouraging people to use. Little they didn't know that we are preventing people from having the pandemic of HIV and drug use. It's rather we treat the drug use on its own and being able to come back rather than treating drug and HIV, which will be more expensive, and also it will be a continuous time of using drugs. So that is also one of our stakeholders who have been supportive, and also Kenya Red Cross, who have been very supportive through the Global Fund. They've supported us to be able to have a smooth running of our harm reduction program, capacity building, institutional building, and also to see how best we can be able to interact. NACADA, National Campaign Against Drug Abuse, have been very supportive. We have been partnership with them in terms of how best we can be able to run the Meritini program, and we are there. We have also provided staff within our community to be able to support the movement within Jomvu and Meritini, Jomvu and Changamwe, to have a drug treatment center within that. And I'm very happy today to say we have more than 300 people who are accessing methadone within Jomvu and Changamwe. And also we have the first inpatient government program that is fully functioning and running within the Meritini area. This is because of the close relationship that we're working in. The law enforcers, from the police commander, regional commander, the county government of Kenya under the inspectorate, have been very supportive. And I want to mention Mr. Changawa and Hadija, who have been very instrumental in terms of organizing, in terms of reaching out to the community, and also involving the staff. And now we have developed ambassadors who are friendly to people who use drugs. We have trained 20 members of their department to be able to have a friendly intervention. They have been taken through their basic counseling, harm reduction, how to be able to have empathy with people who use drugs. And now they're also reaching out when they're doing their work, and also referring people who use drugs from the community to our institution. So all in all, I also want to appreciate the county, Mombasa residents who have been very supportive within the 6 sub-counties, the sub-county hospital, the sub-county committees, the CHMTs at the health community level. We have been very supportive in terms of how best we can be able to ease, and also last but not least, the chief areas within different wards. They've been very supportive. They have been instrumental in terms of seeing alternative for incarceration, and also helping them in terms of access the ID, national IDs. Most of them, they've maybe lost their IDs, or they have not engaged into the process. But with the support that they've been able to give them, and now they're also receiving their Huduma numbers, and all of us are receiving Huduma numbers because of the support from the chief areas that have been supporting us. And those private partners who have been able to support us through the process, Mombasa Maize Millers, Grain Ball, who have been very supportive, especially during this month of Ramadan. They've supported us with full staff to be able to reach out to those who are less fortunate within our community, and also members of our staffing to be able to celebrate the Ramadan in a very good way. And of course, last, the media, mainstream media, the social media platform, bloggers, media personnel who have been very supportive. I just want to, and I think I have no words, because without their initiative, without you, Solomon, your initiative that we started many years with platform like this one's Galatix, which are coming up, we have seen a lot of influence in change within the community. Personally, I have a very big respect to the media and the media personnel, to what you have been doing, because you have changed perception. The questions that we've been asked many times, At times, I feel very proud to see you answering them or responding to them to different platforms. So this is what we call good partnership within the media and the community. And we have a very good experience in terms of how best we can turn around the issues with using the platform in media to air our agenda, to see our advocacy moving, and also how best we can be able to turn the perception of our community. So I thank very, very much to all the media houses, media platform, media personnels, and you, Solomon, for the good work that you've been doing for many years in terms of educating and empowering the community. Thank you.
Thank you so much, TAIB. Maybe at this juncture, just to see some of the comments that have been dropped and probably some of the questions. Ramadhan KE says, Reachout Centre Trust has been doing a good job for a long time. There's a special place in heaven for people working there. All right, TAIB, there's a special place.
Very,
it's an amazing. Congratulations, TAIB.
Yeah, thank
El
you.
Caboose says, nice one to great people on my screen. Thank you so much, my brother El Caboose.
Thank you.
All right, El Caboose says to great people there. Mugabe Were Jr. says, what makes Kisauni be a drug area for over many years? TAIB, I think you will answer that. What makes Kisauni be the hotspot for drugs, if I may say that, for quite a long time? Right? Yes.
Yeah.
Thank you so much, Mugabe, for your question. Alan says, what makes methadone the answer for drug addicts? What is the science behind it? Thank you so much, Alan, for that question. TAIB is going to answer that question. What makes methadone the answer? And is it really the answer for drug addicts? What do you think about the drug amendment bill that is currently at the National Assembly? Asante Gilbert for that question. He's asking what about the amendments for that bill. El Caboose says, what are the sort of programs for prevention rather than dealing with withdrawal of the addicts? Yes.
Sure.
That's a good question, TAIB. What are some of the sort of programs for prevention rather than withdrawal for drug addicts? Yes. And that is a question that has been going on for quite a long time, TAIB. Do we deal with the cutting the supply, or do we deal with the withdrawal symptoms of the drugs? I think we could start with that, TAIB, or any question that you want to start with. Yeah.
Maybe start on the systematic way. First, the drug scenes within Kisauni and what makes it over years and of years, mentioned it very well. Within our baseline, within our research, we have seen, and also up to now, we have a bigger number. The sub-county which is leading Kisauni, following with Likoni, Vita, then Nyali and Changamwe, then lastly John. So what makes Kisauni the drug or the focal point? From my own experience with engaging people and also the availability of drugs, and has made it having more people to use, and also our community has, we can say, has not come out clearly in terms of saying that this is our area and we need this to stop, or we need this to go on this way. And we have seen a lot of people within the supply chain. They want areas that are not areas where they can have hideouts, where people cannot come quickly, like within town. It's not easy to have that ample number compared to that area. So they want hidden places, they want outskirts places. That's why they pour in more drug to that area. And also they find it very easy to work within that system that has been able to have many years. And also the issues of the coastal towns or the coastal cities, like when you talk about Zanzibar, Seychelles, Mombasa, areas that have the Indian Ocean, has been widely affected. So it will be easier to work when you get the commodities to work with the areas or the sub-counties which are nearby in terms of transportation, rather than coming to the areas within town for the sale to happen. And also that acceptance within our community that we have found it, this is how it has been, so we cannot change. We cannot have the impact in terms of change. So we have accepted the process that is happening to us. So from my experience, that is what I can answer. And also the availability of drug itself, making it a high impact of use. The science behind medically assisted therapy, that is methadone program. Methadone program is an antagonist for heroin. Maybe we can have another session to detail and also expand on this, but briefly is antagonist for heroin. This is used specifically for heroin, like what you've said, is not for any other addiction, to be able to ease out the processes. When you use heroin, you'll need to use heroin within 4 hours or 8 hours of use per day to get another fix. But within this, because this is a scientific and also evidence-based intervention, for his answer is an evidence-based intervention, and it is also controlled treatment. You take it every day from the health facility, you're being weighed, you see the blood pressure, you see your body checked on, so that you can be able to see how best it's working within you. And also before started, you're also being taken through a psychosocial support sessions that can be able to share with you. You also share with us what are the impact within drug use and how long we have been using heroin too, so that you can be phased out into this other treatment. So we can say simply this is a medically assisted therapy to try help you ease the withdrawals and also help you to have that alternative from heroin. And eventually, because it's antagonist, it stays with you for 24 hours. So if you take it today until tomorrow, you won't be having any withdrawals. That is the science behind it. The issues of the amendment bill. I've talked about the amendment bill. We've had our proposals. We have seen the areas which are very supportive. We have seen areas which are very porous yet, in terms of incarceration, in terms of putting people into risk of having their privacy known, in terms of drug users. So we are crying for help, and we have sent our proposal to all the 6 members of parliament in terms of what needs to be done. We have also formed a caucus within partners in the country, which our offices are in Nairobi, to be able to move with the policy makers. So we have talked to the chair who was there, who was passed away, but now we are working with the other committee members to be able to see how best we can be able to get the change of the areas that people who use drugs can be able to support, to be supported. And also that is what is going on at the national level and also the county level. We have also supported a bill with our partners who are working together with us to be able to have a drug and substance bill at the county level, because the issues of drug and substance abuse fall under the devolved functions. So we want also county to have a tech in terms of how best can be able to do. And we have shared a very good document which is on its second reading, and we have also gotten some other proposal and also amendments to be able to support. We have talked to the chair, who is very supportive. I forgot to mention about the health committee at the county parliament, which have been very supportive. And one of the clips was the chair, Honourable Kibwana, was talking about support, don't punish. So he has been able to articulate issues of people who use drugs, and they have accepted this. They went through the parliament. Now they are working on the final second reading to be able to get that the proposal from the community to be able to incorporate it within what they're having, and being able to have a very clear document at the end of the day. The last question in terms of prevention. In the prevention programs are very good, and they are very impactful, and they have to be long-term prevention program. It's not during holiday classes or just when people are in school, but we need to have curriculums which are ongoing. So we're working with different partners, especially in the National Campaign Against Drug Abuse, to have continuous education. And they have started very well. They have started training teachers within the institution of higher learning, institution at the Form 4 or a secondary level, primary level, to be able to have ambassadors within school, the way we have those classes or clubs within schools. So that is one entry that we are doing. Prevention program needs to go from our message that we have. It needs to cut across to the family members. I can say with my own experience, if we start with family members in terms of prevention, we'll be doing a very good job. Because when we let him go to school and we have a problem, and you know what really demoralizes us, Solomon? The family members are the last people to accept or to know that their sons and daughters are using drugs. So prevention program needs to be unpacked. It needs to have a change of narrative that we really need to have our responsibility. If my son or my daughter is using today and I'm protecting him and paying the bills and removing him from police station, we don't want to take him to prison, we are literally not helping him out, because we're not talking about the change that needs to be done, but helping him to have that problem being sorted across. So we need to have the prevention program cut across between madrasas, between schools, between churches, Sunday schools, so that we can have a well organized and holistic approach to our prevention program, so that we can be able to have people talk about this, like the way HIV has been taken, Solomon. Drug abuse has not been made as a national disaster. It's still yet to have that impactful knowledge, information within now. We have seen a very good milestones within the departments or the ministry. Their performance contracts are talking about issues of drug abuse, but needs to be done more. The way we've seen those placards within construction buildings that are saying HIV is real, HIV, you need to take precaution. The workers are sensitized on HIV while they are doing their construction work. They are building their roads, they are putting that mark. We really need to have that mark within the issues of drug and substance. And that is what El Cabos was asking prevention program. When we are doing this, when we are going to engagement, when we are going to burials, when we are going to weddings, we need it to remind ourselves the way we have been doing with issues of COVID, so that we can be able to have that impact and ripple effect at the end of the time.
Exactly. That TAIB, my producer tells me we are a bit short of time, but just before we wind up, we have seen the journey for you, especially during the pandemic. We all know the story, the lockdown at Old Town. You guys were locked down, but you were able to overcome all this. Just briefly tell us, TAIB, what are the main areas of focus now as this is a virus that we will live with for a long time. But what are the areas of focus? Yes, especially for you guys who are dealing with our brothers and sisters who have been affected by the usage of drugs.
Yeah, I think last year was very hard. You saw it, Solomon, and we did a story on that, and which had a very good impact in terms of how best we can be able to reach out. And as we are normalizing within the new norm, we have realized that we really need to have integrated services within what we are doing with COVID-19. So whenever we have our own plans, whenever we have our own programs, before implementing, we normally factor in the coronavirus or the COVID-19 measures that we really need to keep on. So we've changed our whole program at the end of the year last year, when we realized that this is something that needs to be captured in, and we have requested support from the county level to have all our employees trained, all our employees go through the system that the Ministry of Health will be able to say these are good measures, and every month we call them in to just check, to have check and balances, because we are human beings and times, and the pandemic is also not sitting around the same. It imitates a lot of things within the going. So we've really gotten a lot of support from the county government, from Dr. Sood, who is a nephrologist at the Coast General Hospital, a consultant who has been very supportive. Every month or 2 months, we'll invite him to give us what are the new areas, or a quarterly basis, to be able to guide us on how best we can be able to. We are working closely with the county commissioner and county governor. Whenever there are measures that have been given, we make sure that we are there for, and also ask for permission when we want to do anything that is beyond our reach or beyond our areas of expertise. So we will be guided within the security apparatus. We'll be guided by the Ministry of Health in terms of how best we can be able to engage. And if it's not possible, we'll tailor-made it to what is available within our county, but to make sure that everyone gets services, which we appreciate the county, the Ministry of Health supporting us within the process of getting the exact medical needed conditions like methadone, which is available, treatment of other ailments, and also supporting us in capacity building to make sure that we have the standards of operational within this period. So that is one of the things. Another area is the commitment of our staff. We've started last year working from home on shifts, but we've seen people, this is what our president has also mentioned, Uhuru Muigai Kenyatta, that there are services which cannot work at home. You cannot work at home. So those who can be able to work at home, we allow them to work at home. But for those critical ones, the clinical officers, the counselors, ourselves who are working directly with people, we've been having challenges, but we work on shifts. We have off days that really need to have also our mental health status to be also well, to support people in good way. We also need to check on ourselves. So we are continuously checking. We have checklists on that, and also going to sessions and supervision because of burnouts within this period. And we are very happy. We've managed to live with the process of COVID well.
Okay. TAIB, how can people reach and contribute to the organization as we wind up, and your Ramadan message as we celebrate you this holy month of Ramadan? And I'm aware that last week you are distributing food hampers to our brothers and sisters who have been affected by drug usage. Yes, TAIB, as we wind up.
Yeah, thank you very much. You can reach us through our social media platform. We have an account where you can also put in or deposit or contribute to the system that we're having. We will share with you so that you can share the community. And also, if you can come yourself physically or send someone to our offices, we have gotten in-kind support also that are supporting us towards this Ramadan. There are food packages that people have shared. And also, if you want to reach out to us, my Facebook account is open, inbox, and also my number is also open. You can share my number with, so that we can have people supporting us throughout the process. And also what we have been doing, we've been seeing every week, we have our encouragement within our brothers and sisters, like what you've seen. We are doing this Friday, also the last Friday, to be able to engage within our community, to see that bond within the stakeholders, the community, and also ourselves, to create that synergy within families. At least people within this month who are fasting, who are almost 250 plus people who have dedicated to fast after a very long time. So we want also to appreciate them and thank them for taking this opportunity, during Ramadan, and perform this very important pillar within our Muslim or within Islam. So this is very good initiative that we are looking into in terms of how best we can be able. And we are seeking for more support and looking for more support. If you have a place, if you have people who are listening to us, want to contribute, please feel free and contribute. And this is on a very good way of reaching to the community, and benefits will reach to the intended personnel. My message to the people.
Yes, TAIB. Yes, just
my message during this Ramadan, we really need to be at peace. We really need to value our neighbors. We really need to live together. We really need to ask for forgiveness, because this is where we have a lot of humility within this month. So please, if you have not reached out to your neighbor, to your friend who you have not talked to, please talk to them, reach out, engage, and also support wherever necessary. Give out, give sadaqah, give the zakah that you have intended to the right people so that it can help them. And all in all, I want to remind every one of us, we are living within this hardship time. We really need to take care. Wear a mask, have social distance, wash our hands. The Ministry of Health guidelines and procedures, please let us all adhere to them. And we know that this coronavirus or this pandemic is real, and we are living with it, and it has no boundary. It affects every one of us and any one of us. So please take care and being able to help within the measures that you have been kept. Yes, sir.
Okay, thank you so much for that, Taib. Just to see some of the comments, Gilbert, if we still have some more comments. Johnson Mwangangi says, great work you are doing, Bwana Taib.
Thank you, Johnson.
Asante sana Johnson. Kibzi Oxygen Abdalla says, je, kunao wanajamii ambao hawaichukulii kazi yenu vizuri na huwa mnatangamana aje nao? Okay, asante sana ndugu yangu. Kibs, tuko pamoja. Nauliza kama kuna wanajamii ambao hawachukulii vizuri kazi yenu, na je mnafanyaje?
Naam, kuna baadhi ya watu ambao labda hawachukulii vizuri kama vile Solomon alivyozungumza, lakini la muhimu kwetu sisi ni kuwa tunawafikia, tunawapatia ile information. Tukipata platform, kuna watu ambao ni wakaribu wetu labda katika jamii ambapo tunafanya kazi, lakini labda wanaona kuwa hili jambo si muhimu. Hili jambo la muhimu ni coronavirus. Labda jambo la muhimu ni poverty. Jambo la muhimu wako na mambo yao muhimu zaidi. Lakini sisi hatubagui wala hatuchagui. Yule ambaye anatuenzi, yule ambaye hatuenzi, tunawafikia kwa sababu tujui lini. Kuna watu kesi ambao tumeziona, wanawapiga watumizi wa madawa kulevya, wanawatesa, wanawafunga. Baadaye wanapata mtu kutoka familia yao ameshikwa na ugonjwa kama huu, ama ameingilia janga kama hili. Baadaye wanakuja wanalia, wanasema mimi nilikuwa nikifanya jambo kama hili, lakini sasa niko na ndugu yangu na mtoto wangu na sitaki afanywe ama apigwe kama wale. So tunajaribu kuangalia, tunawalingania wale wote ambao wanaelewa na wale ambao hawaelewi, na wale ambao wako tofauti na sisi pia tunawafikia, na sasa pia tunawafikia waweze kubadilika na ili kuja katika hii hali ambayo tunaweza kuwasaidia sote.
Okay, asante sana Taib. Sijui kama kuna maoni mengine hapo ndugu Gilbert, na kama kutakuwa hakuna basi just to say thank you ndugu Taib Abdulrahman. Thank you so much for making this webinar session a success. We also want to thank you our viewers for joining us today. Be sure to catch us live on the next story of Ramadan, that is tomorrow. Remember, the conversation continues online. You can use the hashtag stories of Ramadan, the hashtag telling your story. Asante sana. Thank you everyone. We appreciate you for being here. Remember, we're also doing a crowdfunding campaign, Taib, towards building a production house studio. The pay bill number is on the screen. Probably Taib, if you get time, you can also drop something. The pay bill number is 96700 and the account number is 32037. That is a pay bill number to make this a success. And remember to watch our 10 stories of Ramadan. On the videos, you can like, comment and share. Thank you once again for joining us today, and we'll also see you next time. Asante Taib for your time, and God bless you. Kila laheri, Ramadan Kareem and Saum Makbul, Taib. All right, before I will leave you, thank you for all those who are working behind the scenes to make this presentation a success. Asante sana to my producer and Gilbert, if you have the video before we leave, I will leave you with the video. Taib, asante sana once again for making time. Shukran and God bless you.
Kwa majina naitwa Winnie Ambani, mraibu ambaye napata nafuu kupitia kwa methadone. Iko Kisauni, Kisimani. Na nimeweza kufaidika kutokea kwa Reachout Centre ambao waliweza kunichukua wakati nilikuwa natumia miadarati, wakanichukua nikaanza kutumia methadone na nilichukuliwa kwa haraka sana. So wakati nilikuwa hapo Reachout nimeweza kufaidika sana kwa masomo mengi, nimefanya kama business. Leo hii mimi kama mraibu ambaye napata nafuu, nafurahia sana kuletwa Rizfa College ambayo tena ni watu wana graduate, kitu ambayo sikuwa ifikiria. Nilikuwa nimekuwa shut down kwa my dreams. wakati nilikuwa mdogo nilitamani kufanya kitu kama ya saloon. Nilitamani sana kupata degree ya saloon. But niko happy through Reachout Center wameweza kusaidia sisi ambao tuko hapa. Mimi nikiwa mmoja wao. Saizi nasomea mambo na saloon, tunajifunza hairdressing, pedicure, facials, whatever. Kila kitu. Saizi nimepata usaidizi na hapo. Na kwa saizi vile ukiniona hivi niko fresh minded kwa sababu nimerealize nilikuwa kwa slavery. But now I'm sober with Reachout Center ambao nimesaidiwa sana. Nitaajiriwa, nitafanya kazi na nitafungua saluni yangu. So nashukuru sana Reachout, especially Mr. TAIB Abdulrahman wa MP. Namshukuru sana kwa kazi ambao wanatufanyia. Sisi wanawake ambao tumetumia mihadarati. Tumetoka mbali. Tunashukuru sana Reachout Center.